IU Health is a hospital network. We are setting up a hospital chain where we partner with high quality existing hospitals that have been set up by some of the best doctors in the city. And what we promise to the patients is three things. First, high quality clinical outcomes. Second, a best in class experience. And lastly, affordability, but more importantly, transparency on pricing. So, IU Health is that destination that I go to if I want to get any primary, secondary, or tertiary care done. We will have a network of about 30 odd hospitals in Hyderabad in the next 6 months. Today, we are already partnered with 20. So, IU Health will have a hospital partner not more than 15 minutes away from any locality. And the idea is to make high quality healthcare accessible to not just the top 1-2%, but to to everyone.
So, come to today's this press meet. So, what is the main objective of you're conducting this?
The main objective was just to we only entered the Hyderabad market about 2 months back. So the main intent was to put the word out in terms of what we are trying to do. A lot of people still don't know about us in this region. We have, as a company, we have been operational for about 3 years now. Chandigarh and Bangalore were the two markets we started off with first. We found success over there, so we have now diversified into NCR, Jaipur, and Hyderabad. And the objective today is just to to explain what we are doing to ensure that we are better understood and reach out to to anyone who is looking for high quality healthcare.
So, come to Hyderabad market. Why you choose specially? Is there any special?
I would say it's one of the large healthcare markets, right? So we started in Chandigarh. And then we went to Bangalore. So two very different kind of market, right? Chandigarh is, I would say, not as large and also not as modern. So not in terms of healthcare, but in general in terms of the outlook of customers. Whereas Bangalore is probably like the most trusting audience in terms of online businesses. Hyderabad was the next logical move for us. So it's close to Bangalore, which is our head office. But then more importantly, this is also a hub of healthcare for this region. So I think in terms of the density of hospitals, this is among the highest density cities in the country. And Hyderabad doesn't cater to just Hyderabad or some areas around it. It's probably like at least in the entire Andhra, entire Telangana, but also parts of Odisha and some of the even eastern and northeast parts. So it's a pretty strong healthcare hub. And we felt that it was logical for us to then try and gain some market over here.
How you are moving forward in future in Hyderabad market?
In future, so as I said, we partnered with about 20 hospitals now.
Can you name?
Yeah, I mean, so some of the ones are Sia Life Hospital. There is TX Hospital in Kachigoda, in Uppal. Then there is Premier Hospital. So these are some examples. There's a few others. And the idea is to have around, say, 30 odd hospitals on the network. The way we think about our network is that there should be a hospital not more than 15 minutes away from any locality, because patients don't want to travel a lot for the first consultation at least. And secondly, across our network, we should have a good coverage of all specialties, because the kind of hospitals we invariably work with are strong in 2 or 3 specialties, because these are set up by doctors. So say if an onco surgeon and a urologist set up a hospital, oncology and urology are going to be the 2 strong departments. They might not be very focused on cardiology. So then we want another hospital which is focused on cardiology, right? So across the network, you have a good mix. So for Hyderabad, the focus is to add those 5-10 more hospitals. And then I guess we just want to focus on serving more and more patients with those 30 hospitals, but also work with those hospitals on more and more things. So our value proposition to a doctor who owns a hospital is that we will not only help them use their asset better, get more demand in, but we will also help them get better prices on medicine that they are buying, on consumables that they are buying. We will help them process their insurance claims better. We will help them get impaneled with more insurance providers. We will help them have more professional players come in and manage their diagnostic laboratories, right? So there is a plethora of services that we offer to these hospitals. And our intent over the next 6-12 months would be to enable each of these services for all of our hospitals. Today, somewhere we'll do something, somewhere we'll do something. So it's still very much a pilot project of sorts. The idea is to extend that.
How you are collaborating with the hospitals? How you
So we have a team. In Hyderabad. So I am based out of Bangalore, but there's a team based out of Hyderabad who identify what hospitals fit our requirement. Then we have a clinical excellence team that once the hospital is aligned to working with us, we will conduct a small quality audit where we also want to be very sure that the hospital is following all the right clinical quality standards. They are, they are aligned to serving patients in a way where clinical quality is never compromised. If that is clear, then we will partner with them. So it's a very small team, and I guess what we offer to the hospitals is very simple and very unique. So we haven't felt the need to go and meet a lot of hospitals and convince them. It's something that they all value and like. Thank you so much.